Hey everyone, and welcome to our deep dive today. We're going to be talking about something that can be kind of scary for a lot of people.
Yeah.
How doctors figure out if someone has cancer. And we're going to be using information from the National Cancer Institute for this deep dive.
Great source.
It's a U.S. government website, so it should be pretty reliable.
Absolutely. We want to break it all down and try to make it clear and simple. Because we know this can be a worrying topic.
For sure.
We're going to be looking at all sorts of different tests, blood work scans, biopsies. Ever wondered what those actually involve?
Yeah.
Well, let's find out.
It really is like solving a puzzle. You know, your doctor starts with a symptom you're having.
Yeah.
Or maybe something unusual popped up on a routine checkup.
Okay.
And they have to figure out, is it cancer or is it something else entirely?
Right, like a cough could mean a lot of things.
Exactly.
Doesn't necessarily mean it's something serious.
A lot of things can cause a cough.
Right.
That's where these tests can really come in.
Yeah.
And help piece together those clues. Okay, so let's start with something. I think a lot of us are familiar with blood tests.
Mm-hmm.
They seem pretty routine.
Mm-hmm.
But what are they actually telling us?
Well, your blood, it carries signals from all over your body. It's like a messenger system.
Okay.
By analyzing the different components in your blood, doctors can get a glimpse of what's going on inside.
Interesting.
One of the common tests that they do is a blood chemistry test.
Okay.
It measures things like sugars and fats and proteins that are released by your organs. And if some of those levels are off, it can be a sign that something needs further investigation.
Wow, it's amazing how much information can be found in a tiny drop of blood.
It is.
What about a complete blood count? Have you heard that one?
CBC.
Yeah, the CVC.
Yeah, that's like taking a census of your blood cells. It counts your red blood cells, which carry oxygen, white blood cells, which fight infection, and platelets, which help your blood clot.
Yeah.
So if your white blood cell count is really high, for example, that could signal that your body's fighting something off. And in some cases, it could point towards certain types of blood cancers, like leukemia.
So the CVC is helping determine if your different types of blood cells are in the right balance.
Exactly.
Sometimes doctors need to see beyond the blood work, though, right?
Yeah, they do.
That's where imaging comes in, I imagine.
In imaging techniques, let doctors see inside your body without having to actually open you up. They use different technologies to create pictures of your organs and tissues.
That sounds pretty futuristic. What are some of the methods that they use?
Well, one common one is a CT scan. It uses X-rays to create very detailed three-dimensional images.
Yeah.
It's like taking a series of X-ray pictures from different angles and then putting them all together to form a complete picture.
Oh, so with a CT scan, they can get a really thorough look at what's going on inside.
Pretty much.
What about MRI scans? I've heard those are good for looking at soft tissues.
That's right. MRI uses powerful magnets and radio waves to create images, and it's particularly good at showing details in soft tissues, like your muscles, ligaments, and organs. So it can help doctors spot tumors that might be hidden in those areas.
So we've got CT scans for detailed overall pictures,
Yeah.
MRI for a closer look at those softer tissues. Are there any other imaging techniques that are used in cancer diagnosis?
There's also the PET scan, which is pretty fascinating.
Okay.
It uses a special type of sugar that's slightly radioactive. This sugar is injected into your body, and cancer cells tend to absorb it more than normal cells.
So the cancer cells light up
Yeah.
on the scan because they have a bigger appetite.
Exactly. The PET scan helps doctors see which cells are more active, which can indicate areas of concern that they might need to investigate further.
Wow, that's incredible. So we've got the blood test giving us clues from the inside and these imaging techniques letting us see what's happening visually. But I understand the most definitive way to diagnose cancer is through a biopsy.
That's right. While blood tests and imaging can provide valuable information, a biopsy is the gold standard for confirming a cancer diagnosis.
Okay.
It involves taking a small sample of tissue from the suspicious area and examining it under a microscope.
That makes sense. You need to actually see the cells to be sure.
Exactly.
But I imagine a biopsy might sound a bit scary for some people.
It's understandable to feel that way.
Yeah.
But it's important to remember that biopsies are crucial for getting a clear and accurate diagnosis.
Okay.
And there are different ways to perform a biopsy, depending on the location and the type of cancer.
So let's delve into those different types of biopsies next. But first, let's take a quick moment to reflect on what we've learned so far. We've covered blood tests, imaging techniques, and touched upon biopsies. It's fascinating how each test plays a role
It is.
in piecing together this puzzle of a cancer diagnosis.
Absolutely. Each test adds a piece of the puzzle and helps doctors determine the next steps. And as we move on to discussing biopsies, we'll see how this crucial step helps confirm or rule out cancer and provides vital information for tailoring treatment plans.
So biopsies.
Yeah.
Let's recap quickly why they're so important.
Yeah.
We've talked about blood tests and imaging,
Right.
which give doctors important clues, but they don't always give you the full picture.
Right. They kind of point in a direction,
Yeah.
but they don't give you the final answer.
Exactly. Sometimes those tests might show something that's a little bit unusual, but it's not actually cancer.
Okay.
Or they might not pick up on a very small tumor. And that's why a biopsy, where a tiny piece of tissue is examined under a microscope, is so important.
It's like getting that close-up, high-definition look at the cells themselves.
Exactly. Now, there are different types of biopsies. The type that's used depends on things like where the suspicious area is and what kind of cancer doctors suspect. Our source material from the National Cancer Institute mentions a few different types. One that sounds less intimidating is a needle biopsy.
Yeah, a needle biopsy is often a good option because it's less invasive than surgery.
Right.
It involves using a thin needle to take a small sample of cells or fluid from the area in question.
So less poking and prodding involved.
Yeah. I imagine there are different types of needle biopsies, too.
Right.
You're right. There's the fine needle aspiration biopsy, which uses a very thin needle to just collect a few cells.
Okay.
And then there's the core needle biopsy, which uses a slightly larger needle to remove a small cylinder of tissue. So it gives the doctors a bit more to work with.
So those needle biopsies sound like they would be used when the suspicious area is fairly easy to reach.
Right.
But what about when it's deeper inside the body?
That's when you might need a surgical biopsy.
Okay.
Yeah, sometimes a needle just can't reach the area,
Right.
or it might not provide enough information. In those cases, a surgical biopsy might be necessary. That means that a surgeon will remove a piece of tissue during an operation.
I can imagine that sounds a bit daunting to some people.
Yeah.
But it's reassuring to know that there are options depending on the situation.
Right, and of course, with any surgical procedure, there's anesthesia involved.
Right, of course.
And the type of anesthesia that they use will depend on the complexity of the procedure and the patient's overall health. Sometimes local anesthesia is enough. That's where they numb just the area where the biopsy is taken.
Right.
Other times, regional or general anesthesia might be needed. So there's careful consideration given to each individual case.
It's good to know that they think about all those things, but it's important to remember that these biopsies, while sometimes a bit unnerving, are a vital step towards getting the right diagnosis and treatment.
Absolutely. They provide that crucial piece of the puzzle. And, I think it's important to mention, it's perfectly okay to feel anxious if your doctor recommends a biopsy. Don't hesitate to ask questions and make sure you understand the procedure and what to expect afterwards.
Great advice. Knowledge really is power, especially when it comes to our health. And speaking of knowledge, our source material mentions a couple other tests that might be done after a cancer diagnosis is confirmed.
Okay.
These sound a little more complex. Cytogenetic analysis and immunophenotyping. Could you shed some light on those?
Sure. You can think of these tests as getting even more detailed information about the cancer cells themselves.
Okay.
So cytogenetic analysis looks at the chromosomes within the cancer cells. These are like the instruction manuals inside each cell. And looking at them can help doctors classify the type of cancer more precisely.
Right.
Immunophenotyping, on the other hand, focuses on the proteins that are found on the surface of cancer cells. This helps determine how the cancer cells might behave and respond to different treatments.
So it's like these tests give doctors an even deeper understanding of the cancer, allowing them to create a more personalized treatment plan.
Exactly. And that brings us to the next crucial stage, which is determining how far the cancer has spread. Doctors refer to this as staging.
Right, because the stage of cancer is a key factor in deciding what treatment is needed.
That's
So what kind of tests are used to figure out the stage of a cancer?
Well, it really depends on the type of cancer. But often it's a combination of things we've already talked about.
Okay.
Imaging tests like CT, MRI, and PET scans, along with blood tests, and sometimes additional biopsies to get a more complete picture.
So it's really about using all the tools that are available to get the most accurate information possible. A cancer diagnosis is a multifaceted process with each step building upon the last.
It is indeed. But remember, the goal of all these tests is to provide doctors with the information they need to develop the most effective treatment plan for each individual patient.
And speaking of treatment, that's what a lot of people are curious about. Once the diagnosis is made, what are the next steps in that journey?
That's a great question, and one that we'll delve into in our next segment. We'll explore the different approaches to treating cancer and what factors doctors consider when choosing the best course of action.
Welcome back to our deep dive on cancer diagnosis. We've explored the different tests used to detect cancer and determine its stage. But of course, the big question on everyone's mind is, what happens next?
That's a very natural concern. After going through all these tests and receiving a diagnosis, the next step is figuring out the best way to treat the cancer.
So let's talk about treatment options. What are some of the most common approaches that doctors use to fight cancer?
Well, there isn't a one-size-fits-all approach. The best treatment plan really depends on a number of factors.
Okay.
The type of cancer, how far it has spread, the person's overall health, and even their personal preferences. But generally, there are 5 main types of cancer treatment: surgery, radiation therapy, chemotherapy, immunotherapy, and targeted therapy.
Okay, let's unpack those a little bit.
Yeah.
Surgery seems pretty straightforward. You remove the tumor, right?
That's the basic idea. Surgery is often the first choice for many types of cancer,
Yeah.
especially if it's caught early and hasn't spread much. The goal is to remove as much of the tumor as possible, along with a margin of healthy tissue around it, to reduce the chances of it coming back.
That makes sense. But what about when surgery isn't an option? Or if the cancer has spread beyond the initial tumor, what other tools do doctors have?
That's where radiation therapy comes in. It uses high-energy rays to target and destroy cancer cells, or at least stop them from growing and spreading.
Okay.
It can be delivered from outside the body, like using a machine that focuses the rays on the tumor, or sometimes it's delivered internally, using implants or liquids that contain radioactive materials.
So it's like a high-tech way to zero in on those troublesome cells.
You got it.
And then there's chemotherapy, which I think most people have heard of. What's the approach there?
Chemotherapy uses powerful drugs to kill cancer cells
Right.
or slow their growth.
Okay.
These drugs can be given in different ways, through a vein as a pill, or even directly into the affected area.
Chemotherapy has been a mainstay of cancer treatment for a long time. But I've also heard a lot about immunotherapy in recent years. How's that different?
Immunotherapy is a really exciting area of cancer treatment.
Okay.
It basically works by harnessing the power of your own immune system to fight cancer.
Interesting.
There are different types of immunotherapy, but they generally work by either boosting your immune system's natural defenses against cancer cells, or by training your immune cells to specifically target and attack cancer cells.
So it's like giving your body's natural defenses a supercharge.
You could say that.
And finally, what about targeted therapy?
Targeted therapy is all about precision. It uses drugs or other substances that specifically target certain molecules involved in the growth and spread of cancer cells. The idea is to hit those cancer cells with laser focus while minimizing damage to healthy cells.
It sounds like cancer treatment has come a long way with so many options available.
It really has.
But with all these choices, how do doctors decide which approach is best for each person?
It's definitely a complex decision. Doctors consider a lot of factors, like the type and stage of the cancer, the patient's overall health, any other medical conditions they have, and even their personal preferences. It's really a collaborative process between the doctor and the patient.
So communication is key. Patients should feel empowered to ask questions.
Absolutely.
And share their concerns so
Yeah.
they can be active participants in their treatment decisions.
Open communication is essential for creating a treatment plan that everyone feels confident about. And, even after all these discussions and decisions, it's natural to still have questions and anxieties.
That's so true. It's a lot to process, both physically and emotionally.
Exactly. And it's important to remember that there's a whole support system out there for people facing a cancer diagnosis. From family and friends to support groups and online resources, there are people who understand what you're going through and can offer guidance and encouragement.
Well, we've covered a lot of ground today, from understanding those initial symptoms and tests to exploring the different treatment options. I hope our listeners feel more informed and empowered to navigate this complex journey.
I hope so too. Knowledge is power, especially when it comes to something as important as our health. And remember, even though a cancer diagnosis can be overwhelming, there is always hope, and advances in treatment are happening all the time.
Well, thank you so much for sharing your insights today.
It's been my pleasure.
It's been a truly enlightening deep dive. And to our listeners, thank you for joining us. Remember, you're not alone. Keep asking questions, stay informed, and never lose hope.